This is part 5 of the Walker series. This video is intended really primarily for caregivers and how they can help individuals with walking with either a two-wheeled walker or with a rollator. When you're helping somebody with walking, there's a few things that you need to know in order to protect yourself as well as the person that you're helping. So the one thing is to learn how to use the gait belt correctly so you can use it safely and effectively. So I have a video on my YouTube channel on how to use the gait belt. So take a look at that before you start helping somebody if you're not familiar with it. In addition to using the gait belt, it's important that you know what kind of technique the individual needs to use in order to walk properly with the walker or the rollator. So I recommend these prerequisite classes before you start helping somebody. The first one is showing how somebody should walk with a two-wheeled walker, and then the next one is showing how somebody should use the rollator, and they're both on my YouTube channel. Just briefly, these are some pictures of hand positions, how you would hold on to the gait belt. The first one to the left is if somebody needs some assistance, but you don't need to be ready urgently. The second one on the right, that picture is more of a fisted kind of a method where you are really help guiding the person a lot more and you're more ready in case there is a sudden loss of balance. Now we're going to cover 3 scenarios where the individual may need a little bit more of assistance in each scenario.
So this is a scenario where the individual is stable, but he tends to push his walker too far ahead of him, which makes him unsteady. So by simply just controlling the walker, you can overall make him more stable. So we're going to start walking, and it's already too far ahead, so I'm going to block it with my hand so that he doesn't push it too far ahead, and then we're just going to keep walking. And I'm doing some counter pressure because he keeps pushing into my hand, and this way we keep it a good distance so that he's steady. So this is a scenario where the person is unsteady, but he's able to use the walker correctly. So in this scenario, all I need to do is make sure that he's stable by holding on to the gait belt while he's walking. So I can literally walk alongside him while I'm holding on to the gait belt. It's easier for me to have my elbow a little bit in at my side while I'm walking with him because it's less strenuous on my arm. If I'm walking and holding onto the belt with my arm stretched out while he's walking, that's more of a strain for me. So when you're walking, just keep that elbow in a little bit. Okay, so go ahead and start walking. And then one foot passes the other. There you go. Good, so I'm just walking along with him and holding onto the gait belt.
In this last scenario, both the person is unsteady and he's unable to control the walker. So as a caregiver, you're going to have a little bit more hands on deck to control both. So when you're trying to control both, you need to change your positioning to the individual and the walker so that you can help control both without straining yourself.
So as I'm helping control the walker's speed with my hand, I'm also stepping sideways. This is the best way of doing it body mechanic wise so I don't strain myself. And then I've got my hand on the gait belt to help control.
When you're assisting somebody with turns, a lot of times it's easier to stand on the side of the direction that you're turning in. So if you're making a right turn, then stand on the right side of that individual. Now there's going to be some circumstances where because of space or other issues that you're going to have to stand on the opposite side. So for example, if you're making a right turn, but the person needs help with bringing the left leg forward, then you may need to stand on the left side. But bottom line is stand on the side which is most convenient for you and most helpful for the person that you're helping. And then lastly, in terms of cueing, Some people do better if they have a lot of cueing, like turn the walker, now pivot your foot, now step with the other foot, and repeating that. Now, with other people, they just get more confused with more cueing. And what I have found helpful for those people that tend to get a little bit more confused easily is just say, we're going to go over and sit in that chair. Let's go to the chair. And just doing that will help them come along and make their turn easier. So you just accommodate what works best for that individual. So next you're going to see two little video clips. The first one of helping somebody turn with a two-wheeled walker, and then helping somebody turn with a rollator.
So when you're helping somebody with turning with a two-wheeled walker, you literally need to help pull the walker to the side because the front wheels don't swivel. So that's the downside with the two-wheeled walker. But when you start, you want to make sure the person is inside the walker. So let's have you go ahead and step inside. So we're going to do a sequence of walker, step, step, then walker, step, step. I think that's the easiest way to do it. So I'm going to help pull the walker sideways. Now you're going to pivot the inside foot and bigger step with the outside foot. Now I'm going to help them drag the walker sideways and then step, step, and then walker, and then step, step, and then walker, and then step, step. So you see we're not completely turning the walker 180 degrees or 90 degrees. We're just doing incrementally because it's just more stable. When helping somebody turn with a rollator, it's a little bit easier than a two-wheeled walker because the front wheels swivel. And how you do it is you place one hand in the front of the walker, the other hand is on the gate belt, and then you're going to help guide the turn. So you're going to turn the walker just a little bit, then you're going to pivot the one foot and step past it. Then you're going to turn the walker and then pivot and then step past it. You always want to make sure the person stays inside the walker because if they migrate outside, then it's going to make the turn less stable. So you're going to turn the walker and then pivot and then step. So it's walker and then step, step. And then walker and step, step. And that's it.
When helping somebody go up and down a curb, you want to make sure that you're as stable as the person that you're helping. So as the caregiver, you want to make sure you're using good body mechanics, a wide base of support. Also, as far as the individual that you're helping, make sure the gate belt is nice and snug and you have a good grip on the gate belt so you can keep the balance in check more quickly and more easily. And the next thing you want to do is just to make sure that you stay fully focused so that you make sure that there's no misstep as the person you're helping is stepping down. And remember, your balance is as important as the person that you're helping. To ensure your safety and the person you're helping, it really would be advantageous to see a physical therapist to get their recommendations and problem solve what is the safest and best method for both you and the person you're helping. So next you're going to see just one example of how someone would help somebody up and down a curb.
All right, so I'm going to help them get up on the curb, and what I want to do is make sure that I have my hand on the gate belt, palm up. That gives me better leverage. So we're going to wheel the walker all the way to the beginning of the curb here, and then he's going to step closer to the curb. Now I'm going to have my feet apart, one on the curb and one on the asphalt, and now you're going to pick up your walker. With my hand, I'm helping him pick up his walker to make sure it's positioned fully on the curb. Now step a little closer to the curb, and now you're going to step up. Good. All right, so we're going to go down a curb. I already have my hand on the gate belt, palm up, because that gives me better control. And then I'm going to have my other hand on the front of the walker to make sure it stays positioned correctly. So now we're going to first go to the edge of the curb, and we're going to stop. And then now you're going to step forward more to the edge, a little bit more. And the reason for that is when we lower the walker, then he doesn't have to reach as far. So now I have my feet apart. You can have your feet apart on the same level, or you can have 1 foot down and 1 foot up, whatever is most comfortable for you, and also depending on how steep the curb is. So now we're going to bring the walker down. I'm going to keep my hand here and help guide bringing the walker down. And then step to the edge of the curb a little bit more, and then now he's going to step down.
As a caregiver, pay attention to which leg goes up the curb first and which one goes down first. When going up, make sure that the person's strongest leg is stepping up on the curb, because that's the leg that's going to help hoist them up onto the curb. When stepping down, make sure that the person's leg that's stepping down first is typically the weaker leg and probably the more arthritic leg. And the reason for that is because the strong leg is going to help slowly lower them down while the bad leg is reaching for the ground. Some things to consider when you're assisting individuals with helping with walking. The one thing is the medication cycle. If the medications from Parkinson's are working well and the individual is moving better, this is actually a great opportunity to work on walking so they maintain their stamina and the strength that they need to do walking, which is so incredibly important to maintain that mobility. Now, when the medication has worn off, it's much more difficult to walk, so you may need to assist them more. A person's strength can directly impact their ability to walk and how much help they're going to need for walking. So this is one area that is very preventable, maintaining your strength, because Parkinson's itself does not make you weak. It's the inactivity that makes you weak. So seeing a physical therapist to give you a good home exercise program to develop your strength and maintain it would be a good idea. Another thing that impacts the ability to walk is difficulty with following instructions from the caregiver. So if you're trying to get the individual to do certain things, take bigger steps or turn, and they're just not following very well, what you may want to do is just help guide or steer the walker for one and reduce the amount of instructions that you give. Or you may want to say, let's go over there, let's go over to the bathroom, or let's go to the kitchen, or let's go sit in this chair, and then you gently guide the walker into that direction. For some individuals, that works out better. There are some people that experience sudden blood pressure drops, and then all of a sudden, like their knees buckle or they need immediate more attention and more assistance. Those people may be experiencing orthostatic hypotension. First, let your doctor know that you're suspecting that, but also take a look at this video. This is on my YouTube channel. It's Balance Part 3, Blood Pressure Drops in Parkinson's, and it really helps sort out what the problems are, what you can do about it, how to communicate with your doctor. So take a peek at that if that's an issue. Although this idea may not be the best for some individuals, I'm just throwing it out there as a suggestion and just see if it applies to you. But there's something called a Rollator transport chair where you can continue with, when you're helping somebody walk, if all of a sudden their medications just don't work anymore and it's very hard for them to take any more steps, or maybe their stamina is not as good today as it was yesterday, or perhaps they're having blood pressure problems and all of a sudden they need a lot more assistance, this might be an avenue to try to see if you can get out more, because then if you get stuck, then you have a chair and then you can push the individual back home or back to the car without getting stranded somewhere. So that way, the person that you're helping can continue to maintain their walking. They can get out of the house more, which is both good for you and the person that you're helping. So just an idea to try, and it may not apply to you, and you may want to bring it up with your physical therapist or occupational therapist to see if this is a good idea or not. You may or may not know this, but physical therapy and occupational therapy can be a big help for caregivers. Oftentimes, when I've seen individuals come in and they were with their caregivers or spouses or families, I would ask them to show me how they're helping the person that they're helping. And oftentimes, I would see them doing things in such a way where they were really straining their back or just not doing things optimally. So, one of the things is teaching caregivers how to move with proper body mechanics so they minimize or can prevent back problems or shoulder problems. Another thing is educating caregivers on when to do things and when to not do things. Like if a caregiver is helping the individual with exercise, well, if the medication from Parkinson's is not working and the person is more stiff, that might not be the optimal time to help with exercising an individual. You may want to wait until the medication has kicked in and then try and do what you can. So that's just another example. Also, both physical and occupational therapy know a lot about different types of adaptive equipment. For example, in physical therapy, we spend a lot of time on figuring out what rollator or walker is best for the individual. And in occupational therapy, they know a lot about adaptive bathroom equipment like raised toilet seats or grab bars or tub benches. All of these devices are directed to maximize the independence of the person with Parkinson's and also to reduce the amount of strain on the caregiver. And then occupational therapy can come to your home and look at your setup at home and see if they can make any recommendations to just make things more easy and also more safe. So don't forget about your therapies. Thank you.